Thanks for joining the Tabletop Conversations, a weekly discussion on critical issues faced by the injury and violence prevention professional, brought to you by the Texas Injury Prevention Leadership Collaborative. Whether it be in healthcare, nonprofits, or public service, the role of the manager has become ever more diversified, with many staff moving to remote working conditions. Long-standing programs are being postponed, and events and initiatives need to be canceled or scheduled for a later date. This week, we joined Dan Dow from the Texas Department of State Health Services, Richard Hamburg from the Safe States Alliance, Jennifer Northway from University Health System San Antonio, and Stewart Williams from the Dell Children's Medical Center, as they discuss how they've adapted their leadership styles to fit the needs of the current environment.
Well, hi, everybody. It's good to see you. As all of the things that have been happening over the last couple of weeks and the stay-at-home, work-safe orders started to roll across our state, it really got me thinking about, for those of you that have already had work-at-home policies in place, as I started to prepare that for my own staff, the proposal for us to work from home, it really got me thinking about how is everybody adjusting to this and creating a productive, supportive environment for their staff, and what are the challenges they faced versus some successes. Unfortunately, my proposal wasn't approved, so we've been here providing patient support throughout the crisis, and that has been interesting in and of itself. So I'd love to hear a little bit more as we continue to work to talk with our leadership about that opportunity for some of my team members to work from home. How has that been for you? For like example, Rich, you already had some of those policies in place, whereas Dan and Stuart, I know that that's something new for you. So I'd love to hear how y'all have tackled that.
Yeah, sure. I mean, as a national organization at Safe States Alliance, we went fully virtual about 2.5 years ago, and I think it's gone pretty smoothly, to tell you the truth. It's really been a good opportunity, one, to bring additional talent on staff-wise from around the country, having started as an organization that was based in a particular city. And we've been regularly communicating virtually, both amongst ourselves, between the staff, and also with our volunteers, our volunteer leadership, our committees. So, we don't feel it as much, so to speak. We may be better prepared than others, but it's a learning process. And the key is the water cooler talk. How do you make sure that you incorporate what you need on all of your calls? To make sure that you're hearing about what happened over the weekend, how these kids are, and pets and all that.
Jen, I find it very surprising that you have to put a proposal together just to, justify being able to work from home. And I'm very surprised that that wasn't approved. In our organization, it was, we were mandated. And so they really reduced all of our workforce down to just the essential clinical folks in our hospital, to provide that patient care, where everyone else was set up to be able to work remotely. And that happened overnight. And you can imagine the changes, the challenges with that, just trying to go from an office environment where you're very comfortable and working with your teams, to overnight trying to figure out how to manage and how to engage and work with these teams and keep productivity moving. And those challenges, I think our team met together. And Rich, you brought up a great point. I think a lot of it is around that connectivity, keeping people together. And I think one of the things that we did very successfully early on was set up group chats that were open all day long for our team, that they could come in, they could pose a question to the entire team, and it would be answered in a matter of seconds. And then having separate chats for individual specific project teams to be able to function as well has been really, really successful for us.
Yeah, this is Dan with Office of Injury Prevention at Department of State Health Services, and we had a big agency-wide shift that we needed to move. I think I don't know the exact number, but it was hundreds of employees home, and so for us it was a big just kind of infrastructure thing. Firstly, moving all the employees home so they would be out of the office, then getting them laptops, then getting them the VPN tools and the setting up software and all these new things. And that was a huge hurdle. And I think we got through it pretty quickly. I think then there was like the next wave of things of, I think for most of our staff, no one had worked from home before. So we only had one or two individuals who knew how to work, who had worked from home previously. So the thing that we've been seeing is just trying to adjust to working from home and all the difficulties that brings. In Austin, for example, the school district was released too, so that the kids were now at home, and there are different types of challenges at home that even if you worked from home before, now you would see that your kids were home, your spouse may be home from their job too. So everyone was adjusting on different levels for our staff too.
Sure. Well,
yeah, I was gonna say, I think everyone's kind of looser where in environments where you were teleworking and God forbid a child or a pet came on screen to be worried that someone would look askance at you. Now it's hey, great. I mean, I usually ask to see some baby in the background. I think people are a lot looser and getting a little more used to doing it this way, which is nice to see. And I hope that continues forward, even as a lot of people transition back to at some point working more in an office setting.
It's hard to think about going back actually to the old way. This has been so helpful for our team, and our productivity seems to have doubled in the projects that we're working on, where in the past you have those daily interruptions, people stopping by your cubicle or your office, you get pulled into this meeting or that meeting. And in this environment, it really just allows you to really focus. And the other really cool thing about this, I think, that has been a silver lining for us, is it really has increased some of the morale of the team. It's just, they've been able to create their own work environment. They can control the temperature at home. They can choose when to eat. They can go to the bathroom when they want. They can listen to music if they want or not. They don't have to worry about disruptions. And so the whole quality of life seems to be so much better. But their hours, they set those. I think we have some expectations on our team, but that's caused us as managers to have to try to be flexible too, where we might have to get up earlier to get on a phone call with somebody who chooses to work early, or to stay a little bit later into the evening to work with somebody who chooses to work later into the evening. So people are trying to adjust their personal lives and the things that are happening at home around their individual work. And so as managers, being able to react to that has been a learning curve too.
Sure. I've definitely seen some of the things that you're talking about, because of course, as we're here, to be fair, a lot of the of our work is inpatient focused, and so our leadership still felt concerned that it was very important for my staff to be able to provide education and support to families at this time, because unfortunately we've seen throughout this crisis, even with people staying home, we're still seeing those injuries exist in our community, whether home related, interpersonal related. We're still seeing those. So our administration felt it was important for us to be able to still be here, provide support services, even if it was in a virtual environment with our patients. And so that's, to your point, we kind of experienced some of those same challenges with figuring out the technology piece, because we weren't set up to have virtual car seat education appointments or virtual appointments with our seniors about home safety. And so trying to navigate when our system was also making a huge transition to telemedicine and needed their existing technology to support those provider level conversations, we were also trying to navigate those technology needs so we could continue to do the work that needed to be done. So it's interesting to hear y'all's perspectives. I definitely, for our team, we've seen a lot of camaraderie within the team as we've pulled together and had shared experiences about our kids who maybe weren't in school or we didn't have childcare, or trying to figure out how we were going to get the roll of toilet paper that we were all missing, and kind of brainstorming together how to get through our daily life challenges in addition to a new work environment. So it's been very good for our team. There have been challenges, but I've been very surprised at how productive we have continued to be. And honestly, the number of patients that are still really seeking our services and our support. There had been a lot of people who were shying away from support, but people have been very receptive for virtual assistance.
Rich and Dan, I have a question for you guys. Since you guys are working and have a lot of experience working remotely or distributed, however you want to phrase that. When it comes to staff accountability, how do you manage that? I feel like in this environment, all of a sudden you're thrown into the challenge that are my team members being productive? Are they producing the work? Are they working on a regular basis? Or how do you manage that? How do you, for one, give yourself some grace to not be checking in on them all the time, but trusting that they're doing their work, they're professionals? And how do you manage that personally?
Yeah, I mean, I've always promoted a flexible workplace, and remotely, it's even more so. We're all dealing with professionals, and all over the country. And, we basically said, and some of them in different time zones. So we basically said, hey, like 10 to 3, 10 to 4. I mean, that's the period where we would just generally expect everyone to, be available on a regular basis, and know that some are starting earlier, some are starting later. But besides email and those sorts of things, we've had Slack as a great additional way to communicate, and just for some informal type stuff. So we have different distribution channels between us. We have a special channel just for kind of BSing. We have a special one that's like the coronavirus one, where whatever you want to offer up, technical or otherwise. And throughout the outbreak, I've really promoted people to get up and get out and do what they need to do. So, need to mow the lawn, go out and mow the lawn. Need to take care of the kids, take care of the kids. And you can do that when you have a really good staff. So I've found it to be, even pre-coronavirus, a very productive environment, and would think it would, that would continue even throughout this outbreak.
Yeah, I think for me, for a productivity standpoint, we still have a similar schedule. So everyone has the schedules that they had before. Some of them have shifted. Like I think mine has shifted due to just being home more and your environment changing. So getting up later or getting up earlier. But I think the main thing for me is to make sure I just understand the anxiety levels or the barriers that the employees are facing just in their general lives. Usually when those things are resolved and you understand those things, you have a better idea of, hey, this person may be showing up late more because, they have to take their kids and they have to feed their kids in the morning, or they're not able to get to this because of an issue where their spouse is not at home during these days. So for me, it's kind of just an adjustment period of, hey, I see something is either working or not working, and then just trying to get at, okay, what's going on right now. And I think there's kind of a different type of productivity at home too. I think especially with the pandemic, some of our activities have had to totally stop. I'm glad that Jen Northway brought it up, but child passenger safety looks a lot different when you can't be 6 feet near someone. So we're trying to figure out, how do we do these things safely? What are the best recommendations? And in some of these cases, there aren't any that have come out yet. So for each of our teams, we're just trying to make sure that, everyone understands what they're doing, and we understand how the employees are feeling at the moment too.
For those who have organizations where some are working from home, some aren't, is anything unique to the interactivity between those who have to go in and provide services and those who are able to work? Are there any unique positives or negatives to having that mix?
I feel like we are working better as a team. We've learned how to communicate more clearly in terms of what our needs are, not just interpersonally, but even just being clear about from a work perspective. So I think that's been really good. It's it is what it is, that this is what's brought us to that, but it's required for us to be able to advocate for ourselves and what our needs are, and what our, whatever those work needs look like. To Dan's point, it's also given us that opportunity to have some conversations about what are those interpersonal barriers that are making things a challenge. It's hard to focus on stuff if you're worried about things that are happening at home. All
Yeah,
right.
connectivity, I think, is super key in all of this. So I agree with all of you and the tactics that you guys are putting in place. We've done a lot of that ourselves. And I think we try to compensate for that office environment where we always are bumping into each other. So trying to connect and trying to engage each other is really important.
Thanks for watching, and remember to subscribe.